Now to a safety alert. Anderson University confirming a case of the measles. University officials say the student is no longer on campus, but it could have potentially exposed others to the airborne virus.
At this time, all known close contacts have been notified. The number of cases in the upstate now reaching the worst in the country. Health officials in Washington state say the outbreak here in South Carolina is now connected to cases on the West Coast. The Snohomish County Health Department confirming 3 cases in children there who were exposed to a contagious family member living in South Carolina. All 3 children were unvaccinated. The health department determined that family also traveled through the Seattle airport and visited a car rental facility nearby.
Since last Tuesday, the South Carolina Department of Public Health reports 124 new cases. That brings the total number of cases to 558. More than 500 people are currently in quarantine and 85 in isolation. The outbreak is centered around Spartanburg County, but cases are spreading. Along with the cases we mentioned out of Washington state, a case was also confirmed on Clemson University's main campus, as well as at elementary schools in Greenville and Anderson counties. Experts say it's important to protect yourself and the people around you.
Virus is extraordinarily contagious. When you look at numbers that began in very small numbers, and now every 4 days, we're looking at hundreds more children infected. Each person that's infected has the potential to infect 12 other people.
Well, state health leaders say a majority of the cases are people who are not vaccinated, with nearly 90% of the cases impacting kids 17 and younger. Doctors say the best protection is the MMR vaccine.
And we do want to remind you, a person who was infectious and did not know it visited the South Carolina State Museum in Columbia between 1 and 5 p.m. on January 2nd, possibly exposing others.
Anyone there during that time also urged to watch for symptoms through January 23rd. Those symptoms include fever, cough, runny nose, red eyes, followed by a rash that starts on the face. If those symptoms develop, health officials say you should call a healthcare provider before going in to see a doctor.
The Department of Public Health will provide an update on case numbers in South Carolina tomorrow. To get that first alert, be sure to download our WIS News app. You can scan the QR code there on your screen right now, and it will take you to your phone's app store where it is free to download.